benefiting our patients because they're getting that continuum of care outside of just that visit with the physician.
Any role that we can play in keeping a patient at home for as long as it's safe for them to be at home, well, that's certainly something we all want to help support.
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. Today is the fourth episode in our new Revenue Recovery series. The goal for this series is to empower you, physicians, administrators, and revenue cycle managers to effectively communicate and ensure your organization does not leave any money on the table. In this episode, we will discuss how to appropriately capture home health certification and recertification. We will discuss detailed coding guidelines. So we've added a cheat sheet to the episode notes, hoping to make your lives just a little bit easier. I am excited to introduce today's guest. Both are familiar voices for Heart Talk listeners. Every time we talk, we have a spirited discussion. Nicole Knight, Executive Vice President of Revenue Cycle Solutions and Care Transformation here at MedAxiom. Also, Linda Gates-Striby, MedAxiom Consultant, Revenue Cycle Solutions. So welcome back to the podcast, both Nicole and Linda.
Thanks. It's great to be here.
Thank you, Melanie.
All right, so we will learn more about your backgrounds throughout this episode. Also, please check out their full bios in the episode notes if you want to know more. If you haven't listened to the first episode of this Revenue Recovery series, please go back and listen to that discussion on smoking and tobacco cessation. There, both Nicole and Linda respond to the first question that we ask all Heart Talk guests. So why they got into healthcare. And again, we'll have that link in the episode notes. So you'll hear a little more about their background and why they're so instrumental in the work that we do. So Linda, let's get the talk started. To set the stage, what exactly are home health certification and recertification services? And which CPT codes are we referring to?
Sure. As the title suggests, these are codes where CMS has said to the physician or the practitioner who has ordered these services, they're willing to reimburse separately for the certification of that order. So the fact that they are reviewing that the home health agency is following the plan as requested and ordered by the clinician, that's going to outline, the types of services, supplies, the equipment that's needed, maybe the frequency of the visits, the functional limitations of the patient, their treatment goals and prognosis. What the code is designed to be signed and reimbursed separately for the clinician's role in ordering that and or recertifying there. So this is something that when they have that order, they sign off on the order, they submit that to the agency. The fact that they've done that and reviewed and certified is a separately billable service with G0180. So that is the initial review. And then that's only going to be good for 60 days. So if the patient's needs continue beyond that 60 days, then there's a separate code for the recertification, the G0179. And it's just reviewing and oversight of the plan of care that they designed.
Good information. So Nicole, what is the average work RVU and CMS reimbursement payment for these codes?
Yeah, so for that initial certification, that G0180, the work RVUs is at 0.67, and the average reimbursement from CMS is around $52. For the recertification code, which is that G0179, the work RVUs are 0.45, and the CMS average reimbursement is around $41.
Yeah. So, the key here, making sure that you're actually getting paid for the work that you're doing. So, Linda, let's talk about that. What are the requirements for capturing these services?
Well, part of the requirements falls on the home health agency or the service organization themselves. So they will be sending the care plan that, the physician places the order. Now they are going to complete their care plan or work plan. So the requirement of this is that the physician or the clinician signs off on that work plan, certifying that, yes, that complies with what the physician had intended. And the physician or clinician is going to work in reviewing that data as collected and reported back to them, during the time that they're providing these services. Anything that's, test results or questions, those communications in between, all of that is intended to be included in part of this reimbursement. And so you are going to want to make sure that you keep a copy of what they're actually signing and returning to that home health agency.
Okay. So Nicole, what should listeners know about coverage eligibility for the advanced care planning codes?
Yes. So for those advanced care planning codes, for that initial certification, it may be billed when the patient hasn't received Medicare covered home health services for at least 60 days. And then the recertification is billed once every 60 days after, except in a rare situation when the patient may start a new episode before that 60 days may lapse. So again, it's paying attention to those coverage days of that initial certification and that recertification timeframe.
All right, good food for thought and an excellent place to pause for a quick message for our HeartTalk listeners. You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. MedAxiom understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. MedAxiom experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at medaxiom.com/care transformation. Welcome back. We have been discussing revenue recovery with industry experts Nicole Knight and Linda Gates, specifically capturing home health certification and recertification services. So let's dive just a little bit deeper to get a better understanding of ways that we can make sure we're not leaving any money on the table. So Nicole, why is capturing HHC and research services sometimes a bit challenging for the care team?
Well, for these types of services, this is not necessarily a patient with a face-to-face visit and an appointment scheduled. And much of our revenue cycle processes are driven by an appointment or face-to-face encounter. So the most challenging thing is you're already doing this work, completing forms, actually doing the recertification and spending the time on this. It's how are you going to operationalize that and capture the charges if the patient doesn't have a visit scheduled or an appointment. So when you don't have an appointment or face-to-face services, how are you currently capturing those services? And this would fall into that category of being able to operationalize that.
So, Linda, while our listeners may or may not be the people literally coding the services, many are responsible for their program's overall success with revenue recovery. So please give us your top implementation tips for capturing these services.
Sure. Well, number one, just raising awareness that this is a separately billable and codable service. There's so much paperwork and process that clinicians are inundated with. This falls into a category that warrants additional and separate reimbursement. So raising that awareness. And then number two, as Nicole inferred, this isn't something that's necessarily attached to an appointment. Now, maybe the patient did bring the paperwork in at the same time as an appointment, and this is separately billable in addition to the medically necessary visit when that does occur. But a lot of this happens in a vacuum, kind of outside of that process. Mm-hmm. So just tracing, how does that work? Are these coming electronically to your practice? Are they coming through the mail? Are they being faxed? What is the workflow now? How does it go from the home health agency to the clinician and back to the home health agency? And figuring out where do you jump a piece into the middle of that flow to say, okay, but wait a minute, someone needs to enter a charge for this. So that's one of the bigger challenges. I know I was speaking to a group of rural health clinicians, primary care clinicians one day on this topic. And I had a physician say, you know what, I'll help you with that. And he came back about 20 minutes later with a stack of about 20 forms and said, here, I just had to fill these out this week. Can we make sure these get billed? So, they're happening. It's behind the scenes. It may not be something that folks are really aware of, but just raising that awareness, tracking that flow, and figuring out how do we implement a charge in that process.
Right. Nicole, within the MedAxiom HeartTalk community, we always bring our focus back to the patient. So how does appropriately capturing these services ultimately benefit the patient?
Well, the care that happens for our patients as a continuum of their care management happens outside of our clinics, outside of hospital settings, happens within their homes, sometimes happens within other settings. This benefits our patients because they're able to continue their certification of their home health services, the support they're getting, the therapy that they may be getting to help them with activities of daily living and to progress. So ultimately, it's benefiting our patients because they're getting that continuum of care outside of just that visit with the physician, but the physician is coordinating care with their family, with the home health agency, and truly becoming a part of that patient's overall care management.
Yeah, it reminds me a lot of the first conversation we had in this revenue recovery series about smoking and tobacco cessation. If you can have those conversations and do that counseling, again, it's just better for the patient in general. Any last words that you'd like to add to our conversation, Linda or Nicole?
No, I think just an acknowledgement that any role that we can play in keeping a patient at home for as long as it's safe for them to be at home. So many patients want to stay at home. And if home care and connecting them with those services plays a role in that, well, that's certainly something we all want to help support.
Absolutely.
Yeah, so much of the data that we have does support that people do better at home, they heal better, they're surrounded by the folks who love them, and it's a better space a lot of times for the patient. Nicole and Linda, thank you so much for joining me again, sharing your time and your expertise today on MedAxiom HeartTalk.
Thanks so much.
Thank you.
And that is going to do it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom HeartTalk on Apple, Google, or wherever they get their podcast. If you'd like to send us a note or suggest a topic, email us at hearttalk@medaxiom.com. We always appreciate you. Thanks so much for listening.